And the drivers of liver disease, particularly in Europe, include alcohol, obesity, type 2 diabetes, and still viral hepatitis. And unfortunately, those risk factors are very much on the rise. So almost every day, there's 800 deaths from liver cirrhosis or liver cancer across the whole of Europe. So early detection is important really for two main reasons. From the healthcare system, it saves costs to the healthcare because it's very expensive to look after patients towards the end of their disease. But for patients, their overall outlook is much greater if we can find them early, because the liver can regenerate and heal itself. And we set a pilot going in 2012, which was putting a diagnostical FibroScan, which we didn't invent ourselves, but was actually the machine that you see behind my right shoulder, which could be taken out into the community. Patients could be diagnosed with liver disease and then referred seamlessly on to secondary care. And the great advantage of putting a diagnostic into the community is that patients get their diagnosis in a timely fashion, but we can also give them lifestyle advice at the same time, so make an intervention both in diagnostics but also in therapeutics.
We recognise that patients diagnosed late with their liver disease. 50% of patients are diagnosed when they come into ED with their emergency presentation. But we know and recognise that a lot of patients with liver disease have known risk factors. They either drink too much, they're overweight, they have diabetes and other medical problems that can cause them to have liver disease. So there's an opportunity there to intervene earlier if we have the right tools. And over the past 10 years, we've been developing our research and then implementing that into clinical practice so that we can identify patients early. We've been using an innovative database here in Nottingham called eHealthScope, which allows us to go into GP records and identify patients with those risk factors for liver disease. And that means we're able to go in and target certain groups of patients in a community setting that we know have risk factors for liver disease, and therefore we can try and identify them earlier. So it's not necessarily tools, but the way we're working and trying to identify these patients and proactively finding them rather than waiting for them to come to us. So here in Nottingham, we've had innovative thinking about how we find liver disease. We've also been driven by what our patients have told us. They tell us that they were diagnosed late and they questioned us why that was the case. So we have put in a lot of research and work to try and change that, and then use the tools now available to us to identify patients earlier, and therefore we've been slightly ahead of the game compared to other areas of the country.